Hey everyone, it's time for Future Fridays. Today, I'll present a case of recurrent episcleritis. I'm Dr. Anna Lothian, board-certified rheumatologist. Some time ago, I saw a 61-year-old female for recurrent episcleritis, which is an inflammation of the white of the eye. She mentioned being in her usual state of health until about 5 months prior, where she started to feel generally unwell and complained of muscle pain. Shortly thereafter, she developed irritated eyes and saw her ophthalmologist, who diagnosed her with episcleritis and prescribed steroid eye drops. Upon completing the course, the inflammation in the eyes recurred, and her ophthalmologist mentioned it may be a good idea to see a rheumatologist, as there are a variety of systemic autoimmune conditions that can cause inflammation in the eye. She then started to have joint pain in various parts of her body and saw her primary care doctor, who ordered some blood work. She had normal blood counts, a normal kidney function and liver function. She had normal rheumatoid arthritis antibodies and a low vitamin D level. She started supplementing with low vitamin D, but the fatigue progressively worsened and she started to develop neuropathic pain of her right foot. When I saw her and further probed at her symptoms, she mentioned that she had been having a few months of blood-tinged mucus from the nose and some nosebleeds, which she attributed to dry air. That day, I had a pretty high suspicion for a particular vasculitic condition called granulomatosis with polyangiitis, also known as GPA. Over the weekend, her blood tests started to roll in. She had a moderately elevated ANA at 1 to 320, an elevated C-ANCA antibody, an elevated PR3 antibody. But what alarmed me the most was that her creatinine was 1.1. While that may not seem too high, her creatinine 1 month prior was 0.6. I reluctantly called her on a Sunday and told her she needed to be admitted to the hospital for more acute treatment of this condition, as I felt like the vasculitis was affecting the kidney. She was admitted to the hospital only a few days later, and her creatinine on admission was 1.6. She had a kidney biopsy with pauciimmune glomerulonephritis, which is what we see in this condition. This case highlights the importance of prompt diagnosis and treatment. 10 to 20% of GPA patients will present in renal failure at the time of diagnosis. If it is caught early enough and treated early enough, the risk of renal recovery is much better. I'm happy to report that I saw my patient in clinic this week and she's in complete remission. Her creatinine is now near normal at 1.1 and she's back to living her healthy, happy life. I hope you learned something from this case, and if so, please share it with someone in your life that may also benefit from this information. I'll see you again next Friday.